Peter Gabriel, Salisbury Hill, at 10 minutes past 7 on this Saturday morning. Now, drug-related deaths in England and Wales are the highest they've been since records began more than a quarter of a century ago. According to figures by the Office for National Statistics, ONS, between 2015 and 2018, more than 180 deaths were recorded in Bristol, which is up on the previous recorded period. So what's to blame for the increase, and what can be done to stop it rising any further? That is a huge question, but joining me now to try and tackle this is Dr. James Nicholls, who's the Chief Executive of Transform Drug Policy Foundation based in Bristol. A very good morning to you.
Good morning.
Good morning. We're seeing this rise. What do you think is the initial thoughts on what's to blame for this increase?
Well, the main problem really is that across the country, it's not just in Bristol, there's been just a series of devastating cuts to treatment services. And the problem with that is that not only is there cuts across the board, but those cuts often hit the most, vulnerable, the hardest, and it's those people who tend to be at that end of the spectrum and who are dying in the largest numbers.
Figures are always difficult to interpret and can be interpreted many ways, but how quickly can you get the data to correlate with what's going on, if you know what I mean? Because I know sometimes recording it can be difficult.
Well, yeah, it's difficult. I mean, it's very difficult there are probably many more drug-related deaths than are actually recorded because of the way that they're calculated. But also, understanding patterns of drug use is obviously difficult because of the illegality of the activity, and so it's really hard to get reliable data. All we can look at is the trends, and as I say, across the country, including Bristol, that they're going in the wrong direction.
I mean, and what sort of groups of people are we looking at? For example, I mean, perhaps not the most obvious thought is that it's the middle classes with cocaine. Is that one of the things?
Not.
I mean, that seems so simplistic, but I'm just looking at some of the data here.
Yeah, I mean, not so much. I mean, there's a bit of a myth anyway that cocaine is an entirely middle class drug. I mean, I think that's a dated kind of stereotype, really. The price of cocaine has been plummeting, the purity of cocaine has been increasing, and the availability of it's been increasing. So it's no longer, and hasn't been for quite some time, an exclusive preserve of the middle classes. Cocaine deaths have been increasing, but that will often be people who are taking cocaine alongside other drugs, alcohol, and other opiates. So I don't think we can explain it away in terms of saying this is about middle-class cocaine use.
No. We had Andy Marsh, who's the Chief Constable of Avon and Somerset Police, talking to John Darville on Wednesday morning. And we just thought it might be interesting to hear what he had to say when asked how many crimes recorded in the Avon and Somerset area are drug-related.
Well, I can't give you a precise answer, but I do know that it's a lot. Drugs drives violence. Much of the knife crime is associated with people fighting over turf. So that's people involved in the drug dealing. Unfortunately, there's still a good number of people that steal in order to feed a habit. So it is a significant proportion. There are lots of drivers to crime. Yeah. It's a very complex area, but it's probably the most significant one, I would agree.
It's interesting, isn't it? Because everyone describes this as a complex situation. That being the case, what can we do to try and stem what's happening? Well,
I mean, there's some short-term things that we need to do. Improve treatment services, particularly for people with the most complex needs. We need to be providing naloxone, which can be administered if people are overdosing on opiates. We need, in Bristol, there's been calls from politicians and, a lot of local organisations, including the drug treatment providers, for a safer consumption facility for people who are injecting heroin in particular, because that allows interventions in the case of overdoses and also puts people into a much safer space if they're taking those drugs. Heroin-assisted treatment, we know, can really work for people at the harder end of drug dependency. The drug testing, everyone was disappointed that the Boomtown Festival this year didn't have drug testing when we seem to be moving in the right direction on that. And in terms of the clip you just played then about crime, I mean, the reality is that the Home Office estimates that over half of all murders across the country involve, or one or other of the person involved, there's a drug connection. Now that's to do with the fact that the trade is illegal and that there's a huge amount of violence on the supply side of the drug trade. And so we need to look again and transform, we call for this, to look again at the legal regulations of drugs, because so much of the violence and so much of the exploitation is directly a consequence of the fact that the trade is completely unregulated and is dominated by criminal gangs.
There will be people listening to this who've been victims of crime and will find it very hard to believe that it shouldn't just be put someone in jail, rather than spend public money. Also, people listening might think if you take drugs, the risk, you could end up losing your life. So, what's your stance on that? Well, I mean, absolutely, and we absolutely sympathise with that. But the reality is that the crime associated with the drug markets at the moment is primarily a consequence of the crime between suppliers who are competing for the market. That's where a huge amount of the crime occurs, and because of the lack of treatment, because of the lack of regulation, because we're not properly controlling the drug trade, it leads to all these other consequences where we're not able to put the systems in place that can actually help people, to manage their use, and also to control the supply in a way that makes sense, as we do for other drugs like alcohol, where you don't get that kind of violence on the supply side. You don't get landlords of pubs fighting each other for turf. On that point of alcohol, Neil from Broomhill has texted in. He says, with this concerning drug-related deaths, does this include alcohol? I'm assuming not. No, it doesn't. Alcohol-related deaths are calculated separately. So, and counted as a different kind of thing that's going on? Yeah, they are. Yes, they are. OK. Well, thank you very much indeed for sort of putting that into some sort of context for us, and interesting to talk about, because lots of people have very different views, don't they? Because they're very extreme views about it as well, sometimes, about what should be done to resolve this. But really appreciate you talking to us this morning. Thank you very much indeed for joining us on BBC Radio Bristol. Thank you. And that was Dr. James Nicholls, who was talking to us here on the show. He's the Chief Executive of Transform Drug Policy Foundation. I think the gist of really what we all need to do is keep talking about it and to see if we can resolve and get to some sorts of solutions, because the situation does seem to be really increasing. 17 minutes past 7 o'clock is the time. Let's